Coronavirus disease 2019 COVID-19 is a respiratory disease caused by the severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. In the name COVID-19, CO stands for corona, V for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. Common symptoms can include fever, cough, shortness of breath or difficulty breathing, chills, muscle or body aches, fatigue, sore throat, headache, congestion or runny nose, and new loss of taste or smell. Less common symptoms are gastrointestinal symptoms such as diarrhea, nausea, or vomiting. Symptoms may appear from 2 to 14 days after exposure to the virus. Effective April 1, 2020, Code U07.1, COVID-19, was implemented in response to the global pandemic. This was an off-cycle, unprecedented update to the ICD-10 CM as an exception to the code set. Updating process established under the Health Insurance Portability and Accountability Act. The exception was made due to the critical need to uniquely identify COVID-19 in claims and surveillance data. In addition, other off-cycle codes for COVID-19 related conditions were implemented January 1, 2021, as follows. J12.82 Pneumonia due to coronavirus disease 2019. M35.81 Multisystem inflammatory syndrome. C11.52 Encounter for screening for COVID-19. C20.822 Contact with and suspected exposure to COVID-19. C86.16 Personal history of COVID-19. Unconfirmed diagnosis of COVID-19. Code U07.1, COVID-19, is assigned only if the provider documentation either specifically documents a confirmed diagnosis of the COVID-19 or there is documentation of a positive COVID-19 test result. This is an exception to the ICD-10 CM official guidelines for coding and reporting hospital inpatient Guidelines Section 2, Part H. In this context, confirmation does not require documentation of a positive test result for COVID-19. The provider's documentation that the individual has COVID-19 is sufficient. In addition, the provider does not need to explicitly link the COVID-19 test result to the respiratory condition. The positive test results can be coded as a confirmed COVID-19 case as long as the test result itself is part of the medical record. Please note that the advice allowing coding from positive test results is limited to test results for COVID-19 and not the coding of other laboratory tests. If a definitive diagnosis has not been established, or if the provider documents suspected, possible, probable, or inconclusive COVID-19, do not assign code U07.1, instead, assign codes for any presenting signs or symptoms such as fever. If a patient presents with any signs, symptoms associated with COVID-19, such as fever but a definitive diagnosis has not been established, assign the appropriate codes for each of the presenting signs and symptoms. If a patient with signs, symptoms associated with COVID-19 also has an actual or suspected contact with or exposure to COVID-19, assign Z20.822, contact with and suspected exposure to COVID-19, as an additional code.